I'm not as good of a speaker as Kunal, so I need my notes. How do I? Oh, Shazam. Hi, my name is Isaac French, and I am the DPC product manager at KPI Ninja. And I get to talk to you guys about something that every DPC practice gets to worry about or think about. That is, of course, member retention. Now, just simply by show of hands, how many of you are just simply aware or know what either your churn rate or your member retention rate is? That's not very many, but still okay. Now, how many of you that did put your hand up, how many of you know that your churn rate is less than 20%? All right, yeah, now the confidence is, whew, less than 10%? There we go, okay. All right, that's good. Maybe you guys should be up here with me because there's probably a lot to learn about this, and of course, that's what I get to stand up here and show. And so, the real purpose of retention, there's a lot of business purpose behind it and there's a lot of money behind it. But of course, ensuring that members are staying at your organization is obviously the best way to ensure that you're providing the best quality care to those people. Because if you're implementing a weight management program, that's not going to, if you don't have them long enough to be able to see the data, you don't know if it's successful or not, right? And so at the request of many of the physicians that we work with, today we're going to talk about membership retention and what the data says is how to best improve it. So, as we know, DPC is essentially a membership or subscription-based model. One key indicator, of course, is churn rate, or in other words, the proportion of members leaving an organization or a service compared to the total. So, in some of the top companies that are utilizing a subscription-based model, we see churn rates ranging from 1.2% at Verizon, which is insanely good, to Amazon Prime, which is at 10%, and Netflix in between. Now, other organizations that are using a subscription-based model have churn rates a little bit higher than that. But of course, if DPC wants to consider itself one of the best or in the same realm of those that are, really awesome, now we know where we need to get to. So of course, the question is DPC there yet? Well, in short, no. In our studies and across multiple practices and thousands of lives, we identified a churn rate of 18.3%, using the number churned over the average base method. Now, honestly, this is not bad in the whole of the subscription-based models. Dollar Shave Club continues to succeed with a churn rate of around 50%. However, regardless, once we bring dollars into the picture, that might paint something a little bit different. So in 2017, Hint identified that the average DPC adult membership fee was $82.86. So if a physician has a panel of 600 and a churn rate of 18.3%, that's 110 members that aren't going to renew their membership, or in other words, $109,000 that they're not going to be able to, get, or they're going to have to basically refill with new churn. And of course, that's a problem, right? $109,000 is a lot of money. Oh, I went too fast there. So, right. Oh, therefore, yeah, we have a reason to want to improve our churn rates. And not only that, acquiring new customers can cost 5 times as much as it does to maintain an existing customer. And so if DPCs could better retain their customers, marketing costs and time spent meeting with physicians and families, that decreases. And so, of course, you save additional dollars. So then how do we go about improving member retention? Well, existing research will tell us that there are 3 main predictors of churn, and that's, of course, lack of member engagement, the service isn't perceived as beneficial, as well as the costs being too high. And these, of course, make sense. If I don't like the shows that Netflix has, I'm not going to watch it or I'm not going to pay for it. If I don't have time for Netflix, I'm also not going to pay for it. And every time that Netflix increases their prices like they did this month, they see an increase in their churn rates. So services like Netflix, though, are obviously different than what's being provided within the DPC space. And so we went out to ask whether these predictors are the same within DPC. To do this, we analyzed data from many sources across numerous practices and patients to identify what variables, if any, predicted our common dependent variable, which in this study was whether or not members renewed their membership after their first 12 months. That said, I want to take a moment to identify our baseline. In our final, sample size, we identified 83.4% of members renewed their membership after their first 12 months. So just keep this in mind as we break this down then across a number of other predictive variables. The first significant predictor that we identified was age. As patients tend to get older, they tend to renew more often. Those, of course, in the 19 to 40-year-old range renewed much less than those or than our average baseline, right? And so the second significant predictor was the number of chronic conditions a patient has, which we use as a general indicator of health. As the number of chronic conditions a patient has increased, so did their likelihood of renewing their membership. And then our last significant predictor was, of course, the number of visits that a patient had within their first 12 months, physical visits. And so the more visits one had, the greater the renewal rate. And of course, of note is the group with zero. 55.4% of patients renewed. There was a 37% difference in renewal rate between those with no visits and those with one visit, which obviously shows the importance of getting people through the door. Hey. So therefore, just a quick recap. The primary significant predictors that we found, there were three of them: age, number of chronic conditions, and the number of visits within the first 12 months. Now, of course, to be able to identify actionable, really detailed information that you can take home, we need to understand how these variables interact with each other. So when we look at the actual interactions, we see a couple of important things. One is that regardless of health or age, the number of visits still significantly predicted whether or not people were going to renew. The more visits one has, regardless of health or age, brings people through the door. Sicker patients too, those with more chronic conditions, also tended to renew more often, but not as often or as frequently as those that had a lot of visits. And then on the flip side, younger members with fewer chronic conditions tended to renew less frequently than any other combination, especially those with fewer visits. In fact, we found that there was a 49% difference in the renewal between young, healthy members with low visits and those with high visits. Now, truly, honestly, I doubt that this surprises anybody, right? But now we know, and the data here is not lying to us. We now have an actionable, targeted area that we can improve upon, right? So all that said, if you remember a couple of key things, I want you to remember these. The first is that we found an average churn rate of 18.3%. I myself am quite competitive. I imagine many of you practice leaders and physicians are also quite competitive. So take this back, compare it to where you are, and identify where you stand. Now, whether or not you are above or below that, there's still opportunities to improve. And of course, one of those is to get patients in the door at least once per year. If you get all of your patients to come in their first year, there's a 37% increase in renewal rate, or successfully avoiding $119,000 in lost non-renewals. For a more targeted approach, lastly, engage your younger and healthier populations. Now, I am through and through a data nerd completely, but anecdotally, I also happen to be a healthy millennial. And I can tell you this, and I can promise you, I will absolutely prioritize things that cost more than a DPC membership, like Amazon Prime, or Netflix, for something, or over a DPC membership if I don't see that I'm finding the value of it. So as physicians and practice leaders within a technologically forward-thinking environment or movement, engage your younger, healthier populations. If I would have been texted in peak flu season before I was out for 5 days by my doctor, or even now back in Nebraska where the pollen seems to be dripping from the tears in my eyes, legitimately, you can guarantee that I'm going to be in your office. And so if you do that, if you can get your younger, healthier populations in the door twice in their first year, you can successfully avoid and reduce your churn rate by 5.1%, your overall churn, and then, save yourself $30,000 per physician, which is also always important. This is part of a larger study. Contact me for more information. Love you guys.